Welcome to Bite Size Dental Marketing. Today I have Dr. Matthew Allen. Matt, before we jump in, when we stumbled across DifferentKind, the company you founded there, I was immediately in love because I love the intersection of data and marketing and patient care. Before we jump into your company, though, I would love to understand your journey through dentistry and what led you to start DifferentKind.
Yeah, for sure. Well, thanks, Eric, so much for having me. Really, really appreciate it. Excited to chat more, and certainly those are that intersection is something that obviously excites me as well. So, yeah, my backstory: dentist. I live in the mountains of Colorado. I was living in Denver at the time when I was practicing clinically most of the time, working at a federally qualified health center. So not a DSO, but certainly, we had multiple locations, and certainly understanding, how to do that kind of work. And I think I learned a lot about how healthcare could and should maybe operate working there. My specific area of expertise is in patient communication, so something called motivational interviewing, which for those of your listeners who might not be familiar, it's an evidence-based behavior change methodology. It started in addiction therapy and was coming to primary care, and I've kind of helped bring it to dentistry over the past number of years. One of several dentists in the world who's a member of MINT, which is the Motivational Interviewing Network of Trainers. So I was doing a lot of consulting in that space, large dental payers, private practice offices, kind of everywhere in between. And the question I continued to get was, how do we measure this? And I think it helped me realize a bigger problem in dentistry, along with my co-founder, Dr. Kellen Brown, that dentistry just doesn't have a lot of good data unless it's related to financial metrics. So, you go into any dental office and be like, what did you produce yesterday? They're going to probably be able to give you an answer. Be like, hey, what percentage of your patients have cavities? They won't be able to give you an answer. This is one good example, I think, of just the ways that we're operating blind as a profession. And so our goal as DifferentKind was to produce meaningful data sets that drive improvements in patient care, that drive improvements in overall oral health, and that drive improvements in practice growth for the practices that are doing the right things and doing it really well.
Now, how are you collecting that data? I mean, I love the concept, right? But where does the rubber meet the road in how that intersects with the patient experience?
Totally. Well, I'll kind of go back just a little bit. So this is a pretty familiar concept to anyone who's gone to the hospital recently, which I hope you haven't. But if you have, you will get a text message or an email afterwards asking about your experience. That data is actually reimbursable. So what you say directly impacts how much the hospital gets paid, which I think is really interesting. That is obviously currently not the case in dentistry. We do think that that's a not too distant future state for us. And so there is a pretty good evidence base around the kind of data that we collect. And so what we did when we started the company was we went through all the evidence around what are called patient-reported experience measures, or PREMs. Carolyn, my co-founder, there's a ADA report on like patient standards report on patient-reported experience measures, and she's the primary author on that. So we have a lot of good experience in our company kind of looking at those measures. And we said, what are the things that tend to impact trust and loyalty the most? Because we could measure 100 different things, right? You can do lots of different, points along the patient journey, which are very inclusive from the very first moment that they might find you, on Google or a search engine or something like that, right? Until they come into the office, till they re-care. That's a full, long journey. And so we said, what are the things that tend to impact that the most? And so we collect 14 different experience metrics. We also collect 4 different what are called patient-reported outcome metrics. So essentially, dentistry has a lack of outcome metrics as it relates to oral health. And so we said, great, we can at least collect it from the patient-reported side, which again are really important in medicine. The way that we can think about that from like a medical perspective, a good clinical outcome in a diabetic patient would be to measure their A1C. A patient-reported outcome would be to say, can you walk around the block? Can you exercise? Can you do the things that you want to do in your life? And so we collect outcome metrics for patients as well. So that's a little bit of kind of the genesis, I would say, of like why we do it. Now, in terms of how we do it, which was the question, sorry.
No, I love it.
The circuitous route to get there. So we contact patients after their visit. We connect directly to most electronic dental records. So automatically, contact patients after their visit. We know a lot of the information. So we don't ask, hey, what's your name? Like all of that stuff. We know all of that. We know what kind of visit they had. We know who they saw, like all of that stuff. So we're able to make some really interesting data insights once they complete, the feedback that we request from them. And we have some, I think, secret sauce in how we do that, right? Like I said, we have 14 metrics. Certainly, we're not asking every single one of those every single time. That's a lot of questions to answer for any single one person. And so
Right.
we randomize those, so yeah, anyways, we do it after. Also, this is something I say all the time. Sometimes you'll see systems where they might be requesting a Google review or something, which our data is not doing that. But they might be requesting that, and it's like happening immediately when the patient leaves the office. You're like, cool tech, right? It's like geofence. So as soon as you leave the office, like you get a text message and we ask how your experience was. Or they're like asking to do it at the front desk or whatever. And you're like, all right, well, if you're doing it at the front desk, like you're getting some really strong bias, and it's probably not real good data. But we also know, like, this is, I think, part of the benefit of being a dentist is that if you're still numb, you're technically still in your procedure, whether you've left the office or not. And so that's not the best time to ask anyone anything about how their experience was. They are still experiencing the effects of the procedure, right? And so
Right.
We ask the following day. Patients generally prefer to be contacted 2 to 72 hours following their visit to answer questions like this. And so we ask the following day while it's still fresh, but not so fresh that they're numb.
Mm-hmm. On the pre-show, you were mentioning that you see an increase in Google reviews by this. Can you sort of talk a little more about that?
Yeah, for sure. So, I think it's a good question and certainly something we get asked all the time. And I think this starts to get at the heart of like, how does your data impact marketing, right? So we collect private anonymous feedback from patients. So patients can say whatever they want. And we know that in general, when you look at the evidence, patients are more likely to respond when that is the atmosphere that, which is created as the safe space. We do have service recovery. So if they opt into that, right, like, immediately and you can contact them and all that stuff. So we can share that information if the patient so chooses. But what we see when patients are responding is instead of it being a transactional thing, right, because the patient's generally not getting anything out of a Google review. Right. It's like all for the office in general, right? And so when you take away that kind of, I would say, kind of transactional nature of, hey, please leave us a Google review. And you say, hey, we really care about your experience. We would love to know what that was like. What we've seen for most of our offices is that they actually, even, depending on how they were doing before, and we've had offices that work with us that, previously are like really strong amount of Google reviews, doing really well. And they generally stay about the same. Like, we're not going to take those places. But for other places, even if they were asking but weren't getting a ton, we generally tend to see an increase in Google reviews, like 3 to 4 times the amount of Google reviews for these offices. And it's pretty fun to see. It's in some DSOs where we've done some pilots where, hey, this office is on it, this office is not. They're pretty close together. They're doing all the same things otherwise, right? They start on our product and they start to see this really good increase in Google reviews. So I think when patients don't feel coerced or don't feel like they're just somehow in a one-sided like relationship on the like, I want to talk about my experience, they're much more likely to talk about it. And it's just like, hey, we care about you, I think that's a really interesting psychological perspective with which to approach it. Now, I will also say we do have, after they submit the survey, via our platform, there's a post-survey screen that is customizable where they can say, hey, would you like to leave a Google review? So we do, have that available because we know it's so important for dental offices to maintain that visibility. But yeah, we've been really pleased with, how that process has gone, doing it a little bit differently, I would say.
As you've gotten into growing the company and getting more offices onboarded, where do you see the most areas for opportunity for dentists and their teams to talk to patients?
It's a great question. So we just released a white paper in July of this year. Our plan is to kind of release one every 6 months. So this one was on patient experience. And what we did is we looked at all of our patient experience data along with NPS data that we have. And we said, what are the factors, what are the kind of granular patient experience factors that tend to impact NPS the most? Because I think we all want patients who are coming back to our practices, who are going to go tell their friends about our practices, right?
We all want champions. That's right.
Yeah, exactly. Right.
9s and 10s.
There you go. Yeah. We need those apostles. We need someone, to be talking about us. It's much more effective marketing than anything else. And so what we find there is that the 3 most correlated metrics with NPS are what we call shared decision-making, active listening or reflective listening, and what we call patient consideration. So gentle, sensitive, comfort level, etc. Most dentists did not learn that stuff in dental school. Most dentists do not focus on that stuff in initial training. Most dentists, dental offices, dental groups even, aren't really thinking about, hey, how do I help all of my dentists, hygienists, front desk staff, dental assistants, whoever, anyone who's touching a patient, to be the best listener possible. to give patients options when it comes to their treatment, to help them feel like they have the voice and they're the one who's in control of choosing what options they want to move forward with. How do I help them understand that I'm being considerate of them and their time and their comfort and all of the things that matter around that, and to do that really effectively? We just, there's just a gap there, I think, for a lot of places. And so those are the things that I'm most excited about, because yeah, everyone wants to have a dentist that is a great clinician, right? Clinical skill is important. But when it comes to creating those raving fans of a practice, it really is those kind of traditional soft skills, I think, that really, really, really do matter.
That's such an interesting number, and I may ask you to repeat it, but I have an interesting sort of segue into the topic. Some months ago, we did, I don't want to call it a scientific study, but we looked at all the negative reviews that came in across all of our offices. And specifically, we looked at general. We didn't get into the pedos and the oral surgery stuff. But north of 85% of all the negative reviews were non-clinical. It is very rare there was a clinical review. And it was inevitably, a bad one. But it was always someone had a bad day. Now, we didn't have the statistical or the nuance of your data, but it just looked sort of the staff or patient had a bad day, right? Yeah. And it tended to be billing or sort of clerical in nature almost. Now, how does that align with what you were saying about the three primary, drivers of negative?
Yeah, that's super interesting. So the question of like what makes somebody a raving fan of your practice, right? I think is a different question than like what makes someone leave, because they are different, right? Like
they are different.
They're different. And so to your point around, hey, if someone's going to leave your practice, if they hated it and they're never going to come back, like what are those things that drive that? Certainly we see things, so we don't measure specifically around like a specific part of billing, but we talk about like price transparency. That's one of the questions. And that's a huge driver for people, right? When people are frustrated with like, I had to pay more than like I understood I was going to pay. Obviously that then leads to billing issues and whatever. So certainly that's something we see. Honestly, one of the biggest drivers we see, we just did a webinar on this, the recording of which is on our website, totally free to watch, is around wait time. So not the like, could I get an appointment when I needed it? We measure that in a different way. But like literally I walked into the office and how long did I wait? People just, tend to feel that most dental offices don't respect their time. Those are things that we see, and you're right. I think, we see a lot of really negative things around both of those pieces as well. And I think those aren't always something that can't be overcome. We talk a lot about how we want strong feelings in patients. We don't want kind of intermediate lukewarm feelings.
That's right.
Right? Because if you're a strong detractor and somehow you're like, hey, I want to be contacted and we can resolve that issue for you, you'll probably become a patient for life, That's an opportunity for us to repair the relationship. And what a better way to do that than to take something that someone was really frustrated about and deal with it for them, right?
I always say, and there's a million philosophies on patient and customer engagement, whatever you want to call it. I think you should focus on the top 20% and the bottom 20%, because that's where your real opportunities lie. Because I can fix someone who's complaining. I can fix someone who's frustrated. I can fix someone who's willing to engage me. And of course, I want to take advantage of and really take care of my top 20%, because the 80-20 rule applies. 20% of my patients are probably generating 80% of the referrals. Yeah. And, we think that a healthy practice needs to be somewhere around 55 to 50% of their entire new patients should be referral based. Yep. If not, there's some opportunity somewhere in your patient life cycle. But I think to undo that, and while I do want to spend my time focusing on my top 20%, because I should be trying to create more raving fans, not trying to create less angry people. Right. I do need to understand why patients are leaving, because my raving fans are probably experiencing something in that same story. Yep. And I love what you're saying, because when you look at I'll say the real world data out there in the wild on Google, we associate good chairside manner with being amazing clinically. And even though we don't know, as just a general rank and file consumer, we actually don't know the difference. Like, totally. I know how you made me feel. Yeah. The end, right? 100%. I cannot tell you if it was a great crowd. I don't know anything about margins. I know that I was in pain and we talked about it, or I wasn't. Right. So we like people and we associate this amazing clinical care. When we don't like people, we disassociate this great clinical care and we assume, poor. And when you look at the data, it's amazing at how many good reviews just assume great clinical care and how many bad reviews are just assume the same. And I think most offices would do well, especially if you're looking at some of those milestone of I'm looking to add an associate, I'm looking to add new technologies, I'm looking to, build a second office. As you get further away from that core source of, that core dentist, I think you have to leverage some data to determine what's happening in your practice. And I love the model you built at a different kind.
Sweet, man. Well, yeah, no, I totally agree with you. And yeah, I think that for, most people, that goes to when we think about how this data impacts differentiation, right? Because I think marketing, right, is telling a good story to say, hey, like, what is the story that's going to resonate with people and whatnot, and how am I different than the dentist down the street? There's this great study that came out of Australia in 2012. What do people value in their dental care? Some like really cool things out of that study. Some really cool patient quotes too. Listening to the patient voice, I think, is really important, right? And one of the quotes says, like, if you have a choice of 5 people with the same skill set, meaning, like, as a patient, I see dentist, 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 right? Like, all clinically competent, right? And the quote goes on to say, it's more important how they deliver that skill set, than it is the skill set, by itself. And so I think that goes exactly to your point. And I think there's a missed opportunity for most practices when they think about that first touch point with patients, which most often is online. And they're saying, hey, here's what we do at our office. Here's a list of a whole bunch of procedures. Here's, we have great technology. And then you go to the next dentist website and you're like, yeah, we do the exact same thing. We do the exact same thing. It's like every dentist out there is going to try to be really excellent clinically and do the procedures that they were taught in dental school. And, yeah, some people are going to do full arch cases or not, or whatever. And sure, there's things that you can talk about that I think are important that way. But wouldn't it be a lot more interesting if you said, hey, here's some data that shows that 97% of our patients feel like we involve them in their decision making, and that really drives their overall contentment with our office and their willingness to go out and talk to us about their friends. No one else has that, right? So all of a sudden you're telling a different story, and I think in a sea of relative uniform consistency, finding ways to talk about what makes you unique and what you're really great at is certainly going to be helpful.
You hit it. I'm on record many times of saying that I believe that if a dentist would just begin to articulate her or his story, why they chose to be a dentist, how they approach patient care, and really be a human being instead of trying to be this. I know they're not trying to, but they're almost commoditizing themselves by saying, I have an iTero scanner and I have a cone beam and I have the. Yes, and everyone else does too, by the way. I passed 8 offices on the way to yours, and they all had the same thing.
Yeah.
Sure, maybe they do clear aligners and not Invisalign. Maybe but let's be clear, no one cares.
Yeah. In general,
I do care about you as a human being.
Yeah.
And I want you to care about me.
Yeah.
And the end. I don't want to be surprised. I want to understand why I need a crown.
And I want to choose that. I don't even know,
I
don't just want to explain to me well. Like, I want to know what the options are, and I want to say, like, yes, give me the crown, right? Because then I'm more likely to show up, and I'm more likely to do it, and I'm more likely to like take care of it over time, right? Versus, I always say, like, we don't want to do anything to patients, or not, obviously, like, on them. We're not going to do that. We're not even going to do things for them. We want to do things with people, and if you're doing treatment with people, you're going to be way more successful.
No, and I giggle. No, please do. I giggle because when you talk to a typical dentist about patient care, they'll start to say, we have TVs, we have the massage chairs, we have beats that we give them. They can watch TV. And it's like, those are just such I don't know what the term is, but that is just such a false flag of what I'm interested in. I want to be, and when you're doing 3 hygiene checks in an hour and you're running 3 columns, I think dentists need to slow down, because in an industry of consolidation where consumers already have sort of the commodity problem of a dentist as a dentist, I feel like dentists are tripping over themselves to prove that they're the commodity. Yeah. And it's just such a shocking, disproportionate event.
100%. 100%.
Uh,
Yeah. So I think there's a better way to do that. And I think
mhm.
it's something that we're trying to do. Obviously, we're trying to help people understand that and trying to understand, you know, really from the patient voice perspective, right? Because I think that really resonates too. When it's like, this is what our patients say about us, and we care, we
Mhm.
listen, and we try to get better every single day. Even that's a story, right? Like, don't
That
even give
is.
me any of the data. Like, just tell me that you're caring about it, and that's something. And we honestly see some of that. I think in terms of people who when you simply ask like, hey, we really care, we want this feedback, we want to get better, we don't want a Google review. Like, they're more likely to go give me a Google review now because I'm like,
Mhm,
I
mhm,
just want to
mhm.
get better for you, and it's like this
Yeah.
really interesting psychology. So anyways,
Yeah. Yeah. I wonder what it would be like if you had the patient telling that story.
mhm.
If I was the one who had the work done, and now I'm saying I came in, I had my front six worked on, and this was my experience. And afterwards, they made sure that I was happy. They followed up, and I wonder, it would be interesting to sort of get some of those patient testimonials around talking about the experience,
Totally.
not
Yeah,
just
and I think that
no, yeah.
for a lot of people, like, we're starting, I'd certainly start to see some more of that, and even if it's like not great quality, right, it's not super
Hmm,
professional
hmm.
video or whatever, it's like, hey, we're trying to show you like an authentic view of like who this is and what's happening here. I think sometimes what happens though in those and not maybe even for patients, but like think about it in a group, right? You're like, oh yeah, well, like we've got enough videos to show from the marketing perspective, but like anecdotes aren't all of your patients. And I think that's where,
Hmm.
it goes back to the data. Like, if you have data for all of your patients and you can really say, yeah, like, show me what the top 20 look like and show me what the bottom 20 look like and where are opportunities to learn and grow. Everyone wants to feel good about themselves, and everyone's going to be able to find a few patients to put on the testimonial list, because inevitably you're going to have some. And, that's probably not going to tell you everything you need to know about how to continue to get better as a practice and how to.
Well, gosh, Matt, this has been wonderful. I'll in the notes, I'll put links to the white paper and the your website and the webinar you mentioned earlier. But I sure appreciate your time. And if anyone's interested in learning more about what's driving their champions in their practice and what's driving your detractors in your practice, I'd encourage you to look up Different Kind, Dr. Matt Allen. I think they're going to take care of you. It's a wonderful experience, and I think it's going to teach you a lot about what's happening to your patients in your practice. I think it's eye opening.
Awesome, man. Well,
Matt, thanks
thanks for
again.
having me. Yeah, really appreciate it. Great conversation, and look forward to continuing it in the future.